there's a small number of posts that are going to be advertised. Yes, because that's what the province has. So Premier is going to advertise those. We are going to advertise. Premier is going to approve today. We are going to advertise those. In the next 7 days, the advert will be out. And then the other posts are not within our space. It's a national process. A national process that is between the Minister of Health, Minister of Finance, and the Parliament. So as soon as they have concluded their process, we then come and advertise. With that said, Premier, we had agreed with the team that after Premier Ekhulumile, we go back and start dealing with nitty-gritty. So the meeting that we started in the morning will still continue because they only came down when Premier was coming down. So we'll then go back up with them and acting HOD and deal with the nitty-gritties of how we are going to deal with processes. Premier indicated that when we realized, and this is not this year, it was last year, when we realized that in this coming financial year we're not going to have enough money as a province to employ doctors that are finishing ComServe. We then went to the Premier to say we have a problem. Premier, myself, went to the President and explained all of that. Now, as part of that, the President then engaged his own cabinet, because it's a cabinet that's above us, his own cabinet to say, go and look for extra funding for the province. And because they can't just deal with one province, they then said it's for national. So the 800 that was spoken of by the Minister of Finance is in relation to national. Now, who decides what KZN gets out of the 800 is the National Department of Health. So as soon as the Minister of Health has then indicated to us as a province how many posts they are giving us, then we will advertise those. In the meantime, we have also tried to speak to the Premier to say, can you give us even in Tengane? And that Tengane was amounting to about 20, which is what we are going to be advertising. So the process ka 800 is a process of the National Minister and National Parliament. So they will tell us how many posts they have, and then we'll be able to advertise according to that Premier. The reason why the province of KwaZulu-Natal has a problem is that in the past 5 years, we have lost about 14 billion rands cut from a baseline, which means every year allocation that has been made has been reduced either by 2 billion rands, 3 billion rands, depending on the finances of that particular year. So we are the only ones in the country who actually have been experiencing budget cuts to that extent. That is why Premier, when he started, he said the province of KwaZulu-Natal now in its entirety lost a amount of 65 billion rands as a whole province. So it's not just us as Department of Health, it's the whole province. You would have noticed that earlier on, social workers also had a similar challenge, and we had to work on that. About a week ago, Premier and MEC Education was addressing the same issues when it comes to education. So it's not just the Department of Health, but it's the whole province, and it's because the whole province has had budget cuts. Also, it didn't just happen now because there's a budget. It's something that we've been working on even before the new financial year started, because even last year we knew there was going to be a problem, and we have been engaging amongst ourselves. As Premier said, while we also did our due diligence to say what can we stop, where can we cut, the Premier also conducted the same exercise to say, can you stop this, can you stop that? And out of that whole exercise, we're able to come up with at least that minimum. So that is work that we have been doing. They are saying it's been 6 months. It's because we've also been working and trying to find where we can get monies, because where we can get savings, what is it that we can stop so that we are able to at least employ some doctors. We do need doctors in our facilities. That's something you can't run away from. We are short of doctors. We are short of doctors. But the problem is that the monies that are supposed to come have not arrived.